Okay, good.
But I'm just going to keep this really informal, guys. So I did write up a bunch of slides because I kind of feel like in my experience, knowledge is power. So not only do I want to kind of talk about what I do, I'm really passionate about that, but also how we do it and kind of give you guys some understanding behind why we treat certain things certain ways. So that's kind of why I put together this presentation. It probably will take about 20 minutes to go through it. And then if you guys have any questions, I'm happy to answer anything. So let me see if I can successfully share this again. All right. So who am I? So personally, these are my kids. I have 2 boys. I live in the South Hills with my husband. I'm shamelessly showing you a picture of them because they're in the basement right now watching a TV show because my husband is at work because of COVID, the joys of this. So I'm sorry if one of them run upstairs. But professionally, I am a women's health men's rehab physical therapist. I work at CRS Castle Shannon in the South Hills. So my clinic is right across from the new Mindful Brewing right in Castle Shannon. And there's my contact information if you ever want to get a hold of me. So my goals tonight are kind of just to explain what we do. What we do as a group of therapists that specialize in rehabilitating people that have had cancer, to review common issues after breast cancer and its treatments, explain how we can help, and then really answer any questions you guys have about PT. So who are we? This is our 30 or so therapists. We all work in the UPMC systems. We work out of different centers for rehab services clinics. And we have a great team, and we're all really passionate about this. We're called Women's Rehab Men's Health Therapists. And the name kind of comes out of, we don't just do oncology rehabilitation. So I'd say most of us see at least 50-60% oncology rehab, probably a little more for me. We're also all lymphedema therapists, all lymphedema certified. But then the other thing that we do is we do pelvic floor rehab. So we treat women ante and postpartum for incontinence, for constipation, urgency, pelvic pain. So that's kind of what we do and what we specialize in. So we're all spread out throughout the city. So we have people as far north as Erie, as far west as Beaver. So we're all over the Pittsburgh area, and our goal kind of is to have qualified providers that are close to your home. So what we do, and I know people get sick of this term, but survivorship. So I'm so passionate about survivorship. It's one of my big things. So, you know, survivorship to us as physical therapists, and our group in particular, is about maximizing quality of life. So a little background about me, how I kind of got into this. Oncology has always kind of been my passion, and then we've always tried to work with UPMC to establish some better survivorship programs. So we classically have seen a ton of breast cancer, a ton of head and neck cancer, a ton of prostate cancer, and the survivorship programs just weren't very good. So a few years ago, we got tied in with the surgeons and the chairman of the department that deals with head and neck cancer, and now they have a survivorship clinic that I go to every Thursday, which is one of my big passions. I'd love to see us do more of this with breast cancer and all the other cancers like pelvic cancer. But kind of going back to survivorship, for me and for us as therapists, it's so crucial to be addressing the short term. So how are you feeling during and following treatment? But then also long term, improving and maintaining your ability to do everything you want to do. So why? Because survivors need it. So we all know there are so many side effects to cancer, but there are a lot of treatments we can do to address these side effects. And I think classically in medicine, that's what we're not so good about. So the community has gotten so much better at recognizing and educating patients on this. So when you think about rehabilitation during and after cancer treatment, it's not just the physicians, but it's also allied health providers. So someone like me as a physical therapist, occupational therapist, sometimes speech language pathologists, pain management, etc. So I think you guys can all attest this. Our expectation and perspectives as women in general are progressing. So we aren't just satisfied with side effects of going through cancer treatment, or, and when I talk about pelvic rehab, going through childbirth and having those problems, and we shouldn't be. So we still have a lot of patients that come in. My classic story is always, years ago, I saw this lady really active in her 50s, and she came in and she said, "Oh, I'm doing great." And she moved her shoulder and she could barely get it above shoulder height. And she thought she was doing well. But to me, I thought that's no way to live, because I really think we can get you to move better and reach into your cabinet to get your glasses out. And so that's kind of our goal, is to empower people to say that there is a really good chance we can help with that. So, you know, that comes down to what's your personal goal. So is it pain reduction? Is it lifting up your kids? Is it returning to work? Is it returning to CrossFit? Because there's really good research that those things can be safe. Is it changing a light bulb? And these goals are unique for everyone. So when we talk about when and how you can start PT, so definitely early identification and intervention is important. What we often see out of UPMC, for example, is baseline evaluation scripts. So I don't know if every single surgeon gives these scripts. We always are marketing to have them do this, but it's just to say, go to PT and get assessed. So we'll talk about what that looks like, but a lot of times that's post-operatively and ideally before radiation. So even though it's good to identify it early, it's never too late to do therapy. So one of my coworkers just recently treated a lady. She'd had treatment in the 90s, the lumpectomy and radiation, and had shoulder locking. And with PT, they were able to fully resolve her symptoms. So it's really, truly never too late. So if you aren't referred, you can always ask for a referral. This can come from medical oncology, radiation oncology, whoever, your surgeon, or you can come via direct access. So what direct access means is if you're a therapist who's worked long enough, the law currently states 3 years, you can get a certain license that allows you to see a patient without a script for up to 30 days. So for example, I have a script like that. A lot of my coworkers do as well. So the first day you come in, what does the baseline evaluation look like? So first, obviously, we're reviewing your history and your goals, and it affects your personal plan. So did you have radiation, chemo, surgery, reconstruction, and then what are your personal goals in that? We obviously discuss current symptoms or symptoms you're worried about. So I know one of the biggest things that I'm sure you all feel and I hear so often is lymphedema. I'm really worried about getting that. So, are you having swelling in your arm or breast? Difficulty fitting into clothes, heaviness, and then we'll talk about those things. And then our evaluation consists of looking at how flexible and how much motion do you have in your shoulder blades, your arm, and your neck. So when we're looking at this, I always like to tell people, when you talk about the shoulder and treatment after breast cancer, it's not just your shoulder that's affected, it's also your scapula. So when you're moving your arm, 2/3 of your motion will come from your shoulder. 1/3 comes from your scapula, and that's affected by treatment too. So if we're not addressing that, we're really not going to get you as much better as we could. Then we're looking at sensation, strength issues, and then posture, because we all know after treatment, you're here because you're in pain or you're tight from the scar or the radiation, and that's just going to cause more pain and more difficulty moving. So our goal is to address what we call forward head posture, when your head is forward, and to help get the chest opened up and restore that normal motion. We'll also look at the scar and inspect the skin, and then we always assess for lymphedema. So even if someone isn't at high risk, doesn't have any signs, we always do baseline girth measurements just to know what is the size of the arm. So let's say you come back 5 years from now, we still have those measurements in the system and we can compare. And then we'll look at balance and endurance as well. So this is a general list of impairments that we treat. I'm going to go through all of them a little more particularly. So scar issues, radiation fibrosis, issues with the shoulder, neck, and chest, whether it's pain or motion issues, axillary cording or axillary web syndrome, either name is correct, lymphedema, muscle weakness and decreased endurance, functional mobility limitations, and any balance issues. So I'll talk a little bit first about the results of surgery and radiation are two of the main ones as we see it. So first off, surgical scars. So we as therapists, if nothing else, everyone just needs to learn that you need to get your scar moving. So I always compare a scar to cutting down through a cake. So the icing gets stuck down through the layers, and that's what happens with a scar. So your skin becomes bound down to the fascia, and fascia is that connective tissue that binds your body together. And then that can get stuck to the muscle. And so a scar can suddenly become the reason that someone can't really sit up straight or move their arm. So moving any scar is really, really crucial. And that can be easy to do even at home. Then when we talk about radiation, radiation causes radiation fibrosis, which is that hardening of the skin and muscles after radiation. So this happens because there are endothelial cells. They're in the small blood vessels. They get damaged, and this causes edema and inflammation. And then that can cause fibrosis and cording of the skin and muscles. And the good news about all of these things is the restrictions of a scar or radiation fibrosis are largely reversible. So some people, you can get their skin moving really, really well, almost like normal from a scar. Some people still have some tightness, but either way, what you're kind of left with several months post-operatively or after radiation isn't necessarily the maximum mobility you could have. So what do we do to get there? we work on the scar, we work on the tissues. So we do a lot of hands-on work. So myofascial release, which I can talk more about what that is later if you guys want. Skin rolling is another technique we'll use. Scar massage. We can sometimes use what they're called Graston tools. They're metal tools that are pretty popular with physical therapists and chiropractors. We do a ton of exercise. So exercises to improve motion, chest stretches, laying on foam rolls to get opened up, yoga. We love yoga for this type of thing. We do a lot with deep breathing, and then we really focus on ways that you can recreate this at home too. So when I think about a patient after treatment, you might come once a week. Some people like to come twice a week, but that's not as often. Maybe someone comes every other week. It doesn't really matter to us, just as long as you're making progress and if you have things to work on at home, that's great. So when we talk about the shoulder, neck, and chest, so are these areas stiff? Are they weak? Are they painful? And really, if you have stiffness or decreased motion, we want to stretch out the chest like I talked about and restore good posture. That top picture on the left kind of shows a lady adopting a forward head posture versus getting in the correct posture, which would be having your head stacked over your shoulders. And then obviously we're promoting range of motion. So we want to restore what's called your passive range first. So if a therapist was holding your arm, can they move your arm through full motion? Because unless you have full passive motion, you're never going to have full active motion, which would be like lifting your arm up overhead. If you have weakness, obviously we'll focus on strengthening with bands or weights or gravity-assisted exercises. And then in general, if you have pain, oftentimes pain is caused by the above issues, so stiffness, decreased motion, but also people a lot of times have hypersensitivity at a scar or at the area of radiation fibrosis, and we'll do different things to help desensitize that skin so that it's not painful to have clothing on it or painful to give someone a hug. I'm sure several of you are familiar with this type of diagnosis, axillary cording or axillary web syndrome. So if you've had it before, you know that it was pretty scary. You didn't know what it was right at first until the doctor kind of explained it. And if you haven't, it really is not near as scary as it looks. It's something that we can easily treat with physical therapy and a pretty common side effect of treatment. So the research is really varied and not very good on axillary cording, although functionally we see it a ton in physical therapy. So research studies will say that anywhere from 6 to 72% of patients will develop it after a sentinel node biopsy or an axillary lymph node dissection. I anecdotally in clinic would say that I feel like at least 50% of women get this. So what causes it? There's theories that it could be a plugged lymphatic vessel or it could be a connective tissue adhesion. So your tissue gets stuck underneath that scar and it kind of pulls like a web and it can run down your arm. So this symptom will often go away after months, but it's very painful. It limits your motion and it can cause frozen shoulder. So what we want to do is address it with physical therapy because we can treat this really effectively. A question patients ask me all the time is, does this increase your risk of lymphedema? So we think yes, but there's no good research to confirm this. And I will say, and I tell patients all the time, that I've had several women that had axillary cording and they had some swelling around where the cord was. And when their cording went away, so did their swelling. And as far as I know, none of them have ever developed lymphedema. So just take that with a grain of salt. So like I said, the good news is it's really treatable. We treat this super commonly in our clinics. And I will say this is one of the few things. Normally with rehab, I say, we don't want to easy and progress slowly, but this is to a degree kind of a no pain, no gain thing. We do kind of need to stretch that cord almost. So we do a lot of manual hands-on stretching of someone's arm. So we'd be kind of pulling on the arm and pulling through the chest and helping to traction that cord. The cords can pop, which is good. So it might be a second of pain, but then suddenly you'll say, oh my gosh, I can move my shoulders so much better. We give you an aggressive home exercise program to address that and do a lot of exercises in the clinic. So the other big thing people always ask us about is just treating lymphedema. So the more recent study I looked at recently, out of 2.8 million breast cancer survivors, about 200 to 400,000 were thought to have clinically diagnosed lymphedema. However, 49% of survivors self-reported symptoms with or without that diagnosis. So what I'd say is there's a lot of people that will say, I have some swelling, I'm not sure if it's lymphedema, but it's that it's occurring somewhere in my arm. Lymphedema can develop at any time, though it's definitely most common soon after treatment. And then what puts you at more risk? Lymph node dissection, a node biopsy, radiation due, any infection after surgery or after radiation or at any point, And then obesity and high blood pressure can be known to be risk factors for lymphedema. When we see someone for lymphedema, we treat them with what is called complete decongestive therapy. So when you become a lymphedema therapist, you go to a 10-day course. It's very extensive to teach you how to do this. So, I always say, I don't care if you go to UPMC, to be honest. I just hope that you get good care. And all I can say is if you have lymphedema, if you're not going to us, make sure you're going to a certified lymphedema therapist or a CLT, because they're the one that's going to be able to give you the right care for this. So the components of CDT, complete decongestive therapy, is first a massage. It's called manual lymph drainage. So it's a really gentle massage where you almost just stretch the skin. It seems strange to people, but the fluid actually flows right below your skin. It's not really deep. It's not in our arteries and veins. Lymphatic fluid flows right underneath your skin. So what we need to do is just stretch that skin to help get it moving to other parts of the body. The next thing that we need is compression. So if someone already has a swollen limb, ideally you want to bandage that limb. It's the most effective way to decrease the size of the arm and move the excess fluid. And then long term, you would wear some combination of compression garments. So you could wear a sleeve, which would go from the wrist to the armpit. They have gloves, and then gauntlets, which would be a glove without the fingers. And then women can also get breast lymphedema too, or men. And so you can have compression bras for that. Exercise is another really important part of treating lymphedema. So the exercise research is overwhelming. Exercise helps lymphedema, and I'll go into that a little bit more. So we are huge proponents of getting out there and doing things. There's really no level of exercise that has been shown in research to not be appropriate. It's just making sure that, let's say you do CrossFit, I always use that as an example. Don't just go to CrossFit and do your normal routine. You have to work up to it, but as long as you've done that safely, you can definitely return to these type of things. The next thing with lymphedema, and a lot of times patients are aware of this because I think the oncologists are really good at explaining this, is just good skin and nail care. So inspecting your skin, using moisturizer every day. I always tell people, wet your skin if you're not taking a shower, and then put moisturizer over top of it, because then it traps that moisture in your skin. And you don't want to have broken down skin, because that's somewhere where you can get a cut or you get an infection. And either way, that just helps keep your tissue safer and decreases your risk of lymphedema. Keeping nails neat and trimmed, and then knowing the common side effects or signs of infection. So redness that is spreading. So if you have a red spot and in 2 or 3 days it's spreading, you need to go to the doctor. Or if you have pain, warmth, a sudden increase in swelling or fever. Other things you can do to decrease your infection: use common sense in the sun. So use sunscreen, wear a hat, use insect repellent so you avoid having insect bites. Some other examples are, let's say you're gardening, wear gloves. If you're around your pets, just try to be cautious of them scratching. What I always say to people is just try not to be too worried about what you're doing, but just using common sense and taking small steps that can really help your safety and decrease your risk. And the last step, and probably the most important, is just self-management. So empowering you to self-manage. So lymphedema is so frustrating because it's chronic, but what I always like about it is it's one of those things during this journey that is cancer that you can control. So wearing garments, doing massage will get you on an exercise program and get you feeling empowered to treat that. So the last thing I'll talk about is really common, the cancer-related fatigue and deconditioning. So it's the #1 symptom reported by patients undergoing treatment. And as you guys know, the effects are debilitating. It can cause a cycle of deconditioning. Patients are a lot of times told to rest and take it easy, which is true, but there's also great research that shows that exercise helps. So that Cochrane review is a really good research study where they've looked at a ton of different studies, and it showed that aerobic exercise reduced fatigue both during and after treatment, and that it had a positive effect on depression. So there's so much compelling research with breast cancer, with head and neck cancer, that says exercising during treatment can really help. So the American College of Sports Medicine is kind of what we as therapists look at as far as exercise prescriptions. So they had put out guidelines for cancer survivors. So what they said was to avoid inactivity, return to normal activities as quickly as possible, and their goals long-term were to get people to 150 minutes per week of moderately intense exercise, and then resistance training. And obviously this takes into account your pre-cancer physical level and your aerobic fitness and any comorbidities or side effects of treatment. I always love this slide because I love to tell people there's excellent research to support almost any type of exercise you want to do. So resistance exercise, yoga and Pilates, aerobic exercise, aquatics, they are all fantastic. And I'm always happy to give you some ideas of, hey, if you're even worried, even if you're not coming to therapy, is this an okay routine for me to do? Am I ready for this? And we can talk it through. But really the most important thing is it's never one size fits all. So which exercise is best? It's the one you're going to do. So my conclusions of this just kind of are, we can perform physical therapy anytime safely through the stages of care. Early identification is really key, but it's never too late. And the goal is really to improve your quality of life and empower you to manage long-term and live the best, healthiest life that you can. So I'm happy to take any questions you guys want or explain anything extra. My contact information is right there. You're always welcome to reach out to me. If you do think you need PT, I'm happy to give you the information for your nearest clinic, which probably isn't me unless most of you guys live in the South Hills. But you can also get general information at the UPMC website. But yeah, thanks for letting me talk. I really appreciate it.
Well, that was excellent. Thank you so much.
Of course.
I'm gonna end the recording.
And I'll leave this up here a few seconds if any of you guys want to write down my information, but then I'll